Welcome to Coruzant Technologies, home of the Digital Executive Podcast. Do you work in emerging tech, working on something innovative, maybe an entrepreneur? Apply to be a guest at www.coruzant.com/brand. Welcome to the Digital Executive. Today's guest is Jude Odu. Jude Odu is the founder of Health Cost IQ and currently serves as its president and chief product officer. He leads product strategy for the company's enterprise SaaS platform, which applies AI models and intelligent algorithms to help self-funded and self-insured organizations eliminate waste, prevent fraud and abuse, and curb unnecessary health spending. Jude is a healthcare data expert, technology leader, and strategist. He is the author of the upcoming book, Model Optimal Care, a playbook for using technology and non-technology approaches to curb waste and inefficiency within U.S. healthcare, particularly within self-funded, self-insured health plans. Well, good afternoon, Jude. Welcome to the show.
Thanks, Brian.
Awesome, Jude. I'm glad you're here today. I appreciate you making the time. You're hailing out of Phoenix, Arizona. I'm in Kansas City, so easy podcast today as far as traveling. So I appreciate that. And Jude, if you don't mind, I'm going to jump right into your first question. You founded Health Cost IQ after uncovering a $1 trillion problem in waste and inefficiency across U.S. health plans. What surprised you most in your doctoral research, and why hasn't the system fixed this yet?
Thanks, Brian. The single most surprising thing for me was the scale. When I started digging into the data during my research, I expected to find inefficiencies, right? Every system has them. What I did not expect was how pervasive the waste was within our healthcare system and how normalized it had become. As of 2025, roughly $1.6 trillion of our entire health expenditure qualifies as waste. To put that in perspective, if U.S. healthcare waste were its own economy, it would rank as the 15th largest economy in the world. It would qualify for G20 membership. That's how, serious this issue is. It's also remarkable that waste is not limited to government programs like Medicare and Medicaid. It is actually deeply embedded in private employer-sponsored health plans. My research into health plans spending across the country has found that more than half of health plan spending can be classified as wasteful or inefficient. That is 50 cents out of every dollar going to things like overcharges, billing errors, redundant procedures, inflated pharmacy costs, and sometimes outright fraud. So you may ask, why hasn't the problem been fixed? Well, that waste is actually profitable for many of the players involved. And I'll give you an example. When a PBM profits from higher utilization of certain high-cost drugs, or when certain providers are billing at high rates and no one is auditing their bills, waste becomes the business model, right? So the way third-party contracts are structured these days, it builds waste in by default. And I've written about this extensively in the past. And that's exactly why I wrote Model Optimal Care. The tools exist to identify and eliminate this waste. The fiduciary mandate coming from federal legislation exists also. The only thing missing in most cases is just the willingness to act upon it.
Wow, that's just amazing. And Jude, I worked in healthcare for many years on the tech side, and I'd heard some things about waste and inefficiencies. But the fact that when you were researching this problem, this pervasive waste in healthcare, as you called it, you found that the scale was just massive. And I believe you said 1.6 trillion in healthcare waste, I think in just 2025. But
yeah, 1.6 trillion in 2025.
Wow, that is just crazy. And we know there's overcharges, billing errors, fraud, all kinds of stuff. And I'm glad that you are uncovering this or putting more light to it anyway and trying to help fix this problem. So thank you. And Jude, sure. Healthcare IQ uses AI and intelligent algorithms to eliminate waste, fraud, and abuse in self-funded plans. Where does AI deliver the most immediate and measurable impact in controlling healthcare costs today?
That's a great question, Brian. For plan sponsors, the most immediate impact for AI is in claims auditing. The traditional claims review process is broken. Now, most employers assume their TPA or their carrier is auditing claims, correctly, right? But in reality, many of those audits are infrequent. They rely on random samples, and they're typically conducted by the same vendors that are processing the claims. So there's a huge potential conflict of interest right there. But AI changes the equation entirely. So with a well-built AI platform, you can review 100% of claims, every single line item in near real time. That technology can flag things like duplicate claims, upcoding of certain procedures, facility fees without any clinical justification, and things like that, including services that were never rendered. So all that can be flagged by well-built AI systems. There's a study that says that up to 80% of hospital bills contain errors. That's a huge number right there. AI can help to begin to catch those errors more than a manual process can ever accomplish. So health plans that do this can typically expect to see 20 to 30% cost reductions in the first year of deploying this kind of technology. That is real money we're talking about. And I'll give you an example. For a health plan that spends about $50 million annually, even a 14% reduction in billing errors can result in about $7 million of recovery for lost capital. That's extra money you can use to fund better benefits. You can use it to lower premiums for your employees. You can introduce wellness programs, or you can just put it away for a rainy day. The second area I would say is predictive modeling. AI can forecast healthcare utilization patterns, like identifying members that require more help before their chronic conditions escalate. And they can also flag emerging chronic conditions. So basically, what it allows employers to do is to intervene and to get help where help is needed the most before more damage is done. And I think I would throw in pharmacy optimization as the third area here. AI can identify formulary inefficiencies. For example, a situation whereby brand name drugs are being prescribed when equivalent generic drugs exist for a fraction of the cost. So once those changes are made, savings can be very immediate and measurable. So I would say the question is no longer whether to adopt these tools. It is really how quickly you can put these tools in place.
Wow. Great. Thank you for highlighting some of those things. You talked about AI, analytics and predictive modeling, and then formula inefficiencies in pharmacy, for example. And all those are ripe for the technology to go in and flag these things that generally, because of the massive amount of data there, but also the fact that a machine can do things much more efficiently and faster and take on that level of work to audit. So thank you. And Jude, you're the author of the upcoming book, Model Optimal Care. How does this concept move beyond traditional value-based care, and what gaps does it address?
Yeah, so value-based care has been around for over a decade now. It did move us in the right direction because what it did really was it tied reimbursement to outcomes rather than volume, which is very admirable. But it was designed primarily for providers and health systems. It was never built for employers. And guess what? Employers fund the majority of healthcare in this country. About 160 million Americans get their coverage through employer-sponsored plans. So there's no meaningful framework built for them until now. So I saw that as a massive gap. Model Optimal Care addresses that gap directly. It is a framework I introduced in the book as an evolution beyond value-based care. It's individualized, it's technology-enabled, it's methodical, it's measurable, and most importantly, it's results-driven. It's designed for the self-insured industry and everyone that plays within that industry, employers, third-party administrators, PBMs, brokers, etc. And the core framework rests on 5 principles. The first one is transparency, which says that employers must have full access to their claims data and a clear understanding of every vendor contract that they've signed. So that will allow them to benchmark themselves, what they're paying against what they should have paid in the first place. And that exercise alone can expose millions of dollars in overcharges. The second core principle of Model Optimal Care is accountability. every vendor in the supply chain, whether it's your third-party administrator, your PBM, your carrier, they must be held to performance guarantees based on measurable outcomes. If a vendor cannot demonstrate value, you have the right to replace them. The third will be integration, specifically integrating your data across the spectrum, your pharmacy data, your medical data, wellness data. They typically live in silos. I urge them to be integrated into a single repository. And once you do that, you see that patterns begin to emerge that simply cannot be seen when data is fragmented. The fourth one I would say is engagement. Employees are critical stakeholders in any health plan. They need access to price comparison and care navigation tools and to telemedicine, and they should be incentivized to choose high-value providers. And the fifth is technology enablement. And what I'm talking about here is AI, predictive modeling, real-time analytics being deployed to audit all claims and to forecast high-cost events and to identify inefficiency at scale. So while value-based care asks providers to deliver better outcomes, model optimal care asks employers to take ownership of their health plan operations and to use every available tool to eliminate waste. And the book provides the roadmap for doing that.
That's amazing. Thank you so much. And let's just highlight what you talked about here. Value-based care was great for the healthcare outcomes, right, of the patient, but again, designed around the providers. But your model optimal care talks about that gap, right, with the employers, self-insured. The employers need to take ownership of this. And just real quickly, I took notes here. 5 tenets of the model optimal care was transparency, accountability, integration, engagement, and technology enablement. So I appreciate you sharing that with our audience today. Those are just gems for us. We're going to have to pick up that book. And Jude, the last question of the day, as we look ahead, how do you envision self-funded and self-insured healthcare evolving over the next decade? And what must change for cost-efficient, high-quality care to become more the norm rather than the exception?
So, Brian, I think over the next decade, I see 3 major shifts. The first will be that self-funding will become the default, not the alternative. Right now, about 67% of insured U.S. workers are covered by self-funded plans. And if you look at large employers with 5,000 or more employees, the rate is actually at 95%. So healthcare costs have risen more than 5% annually for the past 3 consecutive years. And this year, 2026, is projected to have an increase of 6.5%. So these numbers make any other model for providing healthcare really hard to justify. So employers who self-fund, they own their data, they control the vendor relationships, and they can deploy the kinds of technologies that I'm recommending in my book. Other models like fully insured arrangements simply cannot do that. The second shift I see is PBM reform. Pharmacy benefit managers are on the verge of significant change. There's a PBM Reform Act from 2025 that is making its way through Congress and is going to tackle things like spread pricing, opaque rebate structures, and things like that. These are things that PBMs have been getting rich off of for several decades now. Think about it. So there are 3 PBMs, Optum, Express Scripts, and Cigna, and CVS Caremark. Those 3 PBMs control almost 80% of the PBM market in the United States. And for decades, they've been profiting at the expense of employers and patients. So I'm advising self-insured employers in my book to move to what is known as fiduciary PBMs, who operate on a more transparent model than these traditional guys. And employers have been shown to save anywhere from 15 to 30% by moving to that kind of model. The third shift, I would say, is going to be price transparency, becoming more operationalized. Federal law already requires hospitals and insurance to publish pricing data. And so what we're recommending is that employers can now use that data to match actual claims payments against what they should have paid or see where they may have overpaid and make changes. So what must change, you ask? Well, I would say 3 things. First, employers must stop treating healthcare as a fixed cost and start treating it as a managed asset. Think about it. If a CFO saw 50 cents of every dollar going to waste in any other budget category, there would be heads would roll. I mean, there will be an audit the very next day. So healthcare should not be run any differently than that. Secondly, employers must take fiduciary responsibilities seriously. They are legally required to ensure that their plan assets are used prudently and in the best interest of plan participants. And third, organizations must invest in technology. I'm talking about AI for claims auditing. I'm talking about predictive modeling, talking about price transparency tools. And these are tools that are available today and they can deliver measurable results. So the employers who adopt them first will control their costs and improve their outcomes. Those who do not will continue losing money to a system that profits from inaction and indifference. So the path forward is clear, Brian. The tools are available. Model Optimal Care provides the roadmap. The only remaining question is which organizations will lead and which ones will follow. Thanks, Brian.
Awesome. Thank you so much. You talked about that 3 major shifts in healthcare over the next decade. You talked a little bit about self-funding will be the norm. Fiduciary PBMs, people should move to that, having more transparency in that. And of course, price transparency is a big part of that as well. But I'd like to highlight, since we do talk a lot about tech, that you definitely recommend investing in the newer technologies like AI, predictive modeling, analytics, et cetera. I think that's important that we embrace that so we can be successful in reducing that fraud and abuse that we see across the country, across the world. So I appreciate that. And Jude, it was such a pleasure having you on today, and I look forward to speaking with you real soon.
It was my pleasure as well, Brian. Thank you.
Bye for now.